Lobotomy is a form of neurosurgery historically employed as a treatment for various mental disorders, such as schizophrenia, bipolar disorder, and severe depression. In the past, it was considered an extreme but viable solution when all other forms of treatment failed, often yielding dramatic and highly unpredictable results. However, the procedure is now seen as barbaric and unethical, largely abandoned due to the development of more effective and less invasive therapies, including psychiatric medications and psychotherapies. The word lobotomy is derived from the Greek words lobos, meaning lobe, and tome, meaning cut or slice. It's a term that describes the surgical incision into the frontal lobes of the brain. This area of the brain is responsible for a range of functions, including problem-solving, spontaneous activity, memory, language, initiation of voluntary movements, and judgment. The procedure was developed in the 1930s by Portuguese neurologist António Egas Moniz, who believed that mental disorders were caused by fixed circuits in the brain, and by severing these connections, patients could be relieved of their symptoms. Moniz was awarded the Nobel Prize in Physiology or Medicine in 1949 for this work, although his contribution is highly controversial today. The most common technique for a lobotomy involved the surgeon drilling holes in the patient's skull on either side of the frontal lobes, then inserting a specialized instrument, known as a leucotomy or orbicalist. The instrument was used to sever the connections between the frontal lobes and the rest of the brain. In the late 1940s, a modification of the procedure, called the transorbital lobotomy or ice pick lobotomy, was developed. This procedure was quicker and could be done without a traditional operating room, but was also riskier and resulted in even more unpredictable outcomes. Lobotomies had a wide range of effects on patients. Some exhibited a reduction in symptoms, but it often came at the cost of significant personality and cognitive changes. Many became emotionally blunted, apathetic, or displayed childlike behavior. Some were left severely disabled or even died as a result of the procedure. Today, the lobotomy is largely seen as a dark chapter in the history of mental health treatment. While it did lead to some important discoveries about brain function, the cost to patients was enormous. It stands as a stark reminder of the harm that can result when medical treatments are adopted without sufficient understanding of their effects or consideration of their ethical implications. With the advent of antipsychotic medications and a better understanding of mental illnesses, the lobotomy has been entirely replaced by safer and more effective treatments. Its use serves as a cautionary tale for modern medicine, a poignant example of how good intentions can lead to tragic results when tempered by lack of knowledge and disregard for patient well-being.